All right, good evening, top-notch friends, and welcome to your Anatomy and Histology Summary Lecture and Quiz Masters session for tonight. So guys, good evening sa inyong lahat na nanonood sa top-notch portal natin. And to those here present, for my class who are present here in our Zoom, good evening to you guys. I hope that you have had dinner already. Okay, so for tonight, we have two speakers for today. So first, let me introduce you to them. A little bit later, before we start our session, let us start our evening with a prayer. So let us put ourselves in the holy presence of the Lord. Lord, as we gather here today to engage in the pursuit of knowledge and growth, we come with open hearts and eager minds. We are grateful for the opportunity to learn, to explore, and expand our horizons. Bless our time together with understanding, patience, and respect for one another's perspectives. Grant us the wisdom to grasp complex concepts, the courage to ask questions, and the determination to overcome challenges. Guide our teachers as they impart their knowledge and guide us as we receive them and internalize them. In this journey of learning, may we find not only the answers, but also the joy of discovery. With gratitude in our hearts, we open ourselves to the lessons of this day. This we ask through Christ our Lord. Amen. All right, guys. So I hope that everybody is ready for tonight's summary lecture for anatomy. And of course, our first quiz master session for anatomy and histology. So let me introduce our speakers for today. First, we have from top-notch batch November 2020, top 7 of the November 2020 PLE, currently a resident at PGH Orthopedics, top 1 of the PT licensure examination in 2014, and a graduate of the Pamantasan ng Lungsod ng Maynila. My dear doctors, we welcome Dr. Ernest Paul Calazans for our summary lecture for anatomy. And also, we have our quiz master for this evening, a graduate of Manila Central University, a top-notch Genesis batch 2021, and also a top-notch online batch March 2023. Let me introduce to you Dr. Jessica Comidjan Custodio. All right. So guys, hardcore ang ating mga speakers for tonight. So before we start our session, may we have some words muna from our president, Dr. Enrico Paulo Banzuela.
I'll let si Ernest give his summary lecture muna. I'll have some announcements regarding some quality assurance clarifications doon sa handout natin. Tapos kung ano yung plano doon for the practice test. May important na announcement tayo regarding that. So unahin na muna natin itong kay Ernest. Okay, one of our best teachers sa Top Notch. Okay. Talk to you about extremities doon sa main lectures natin. Ernest, go.
Hello, good evening. Good evening, everyone. So, live tayo right now sa Zoom and sa Top Notch portal. So again, I'm the one who delivered your extremity lecture. I hope you're able to watch the video. And for tonight, now we're going to discuss handpicked topics about anatomy. So ito, for the past years, mga natanong. And we'll start. Okay. Sorry, can you see my slides?
Yes, Doc.
Sige. So we'll start with the anatomy and histology summary lecture. Okay, so starting with, so by the way, since we have the opportunity to be live, so people in the Zoom, you can participate and try to answer the questions, mga pop questions along the discussion. Okay, so starting with let's start with some neuroanatomy and histology, So when you ask, minsan na nalimutan natin neuroanatomy and histology is part of the anatomy. So if you ask, Doc, nagtatanong ba neuroanatomy and histology, So far, in the past 2 exams, yes, definitely merong questions, about neuroanatomy and histology. And one of the topics, na so far, lagi ko siyang dinidiscuss in pearls, in the main lectures, it's your pituitary gland, So around mga 6 exams, past 6 exams, nandun siya. Okay, so starting with your pituitary gland, no? Also known as your hypophysis cerebri, no? So grade 1 description, no? It's your master endocrine gland. Okay? It's a pea-sized or pea-shaped gland, no? So far, ito yung tinanong, no? The weight of the pituitary gland, no? So what is the weight of your pituitary gland? It's a 2019 question. So it's 0.5 grams, no? 0.5 grams. So pag naka-red, pag may star, usually in my lectures, no, natanong na sila. So the weight of your pituitary gland is 0.5 grams. And if converted into ounces, no, it's around 0.018 ounces, no? So ayan, no, nagtatanong ba ng ounces conversion? Yes, no? Definitely yes, no? Kasi yung gallbladder before, no, we know that it's 30 to 50 ml, no? Pero ang tinanong is weight, no? And it's in ounces, no? That's around 1 point something, no? 1 ounces. So be mindful also of the conversion, no, into ounces. So again, pituitary gland is 0.5 grams, no? So pop question, no? How about your pineal gland, no? What is the weight of your pineal gland, no? You can start writing your answers in the chat box. Now, what's the weight of your pineal gland in grams? Pineal gland, okay, in grams. No? So, there are actually different answers. I'm not sure yung 172 grams, no? But based on Snell and based on the historically na natanong sa board exam, it's 0.1 grams, no? That's also found in your Snell, no? Your pineal gland is 0.1 grams. Okay, good. Okay, so your pituitary gland is a protrusion of the bottom of the hypothalamus at the base of the brain, and it lies at your pituitary fossa or your sella turcica, which is part of your sphenoid bone. Okay, so far natanong na din, no? Kasi yung location niya. So this is a diagrammatic representation of your pituitary gland. So in here, this is your hypothalamus, no? So a downward continuation, it will be your pituitary gland. And as you see, it's covered by parang siyang trono, no, ng pituitary gland, no? This is your sella turcica. Okay, again, no, pop question. Which continuation of dura mater, no, covers your sella turcica, no? Which part or extension of your dura mater covers your sella turcica? Sige, let's see at the chat box. Part or extension of the dura mater that covers your sella turcica. One answer, falx cerebri. Any other answers? No, that's actually your diaphragma sellae, no? Diaphragma sellae, no? So the part of dura mater that covers your sella turcica. Okay? So your pituitary gland is still divided into two parts, no? An anterior pituitary gland and a posterior pituitary gland. Okay? So in here, yung anterior pituitary, madali lang siyang tandaan, no? Because it is also known as adenohypophysis, no? Anterior, letter A, adenohypophysis, also letter A, no? Anterior adenohypophysis. Okay? One point of question is about its origin. Okay? Your anterior pituitary gland originates from your Ratkes pouch or your hypophyseal pouch, which is an upgrowth from your primitive mouth. Okay, and as you see, based on its structure, it contains glandular epithelium. Okay, let's discuss further later. While your posterior pituitary gland or your neurohypophysis, it's a downward growth from the forebrain, no? Specifically the hypothalamus, and it contains nervous tissue, no? So pag tinanong ka, which part of the pituitary gland produces hormones, no? Kung titingnan mo lang yung structure, no, that's actually your anterior pituitary gland, no, because it contains glandular epithelium. Okay? So your anterior pituitary is still subdivided into three parts, no? Your pars distalis, which is the largest and responsible for hormone production and secretion, no? Specifically your FSH, your LH, ACTH, TSH, prolactin, and growth hormone. Okay? So yung mnemonic natin before, no, it's flat pig, no? FLATPG, no? Flat pig. Those are the hormones secreted by your pars distalis. Okay, the second part is your pars intermedia. Okay, so this is your pars distalis, no, the largest part. Your pars intermedia lies between the anterior and posterior pituitary. Okay, and your pars tuberalis, no, the one that covers or surrounds your infundibulum. Okay, so in terms of arterial supply, it's supplied by your superior hypophyseal artery. Okay. Meanwhile, your posterior pituitary gland, it contains your pars nervosa, okay, which is the main part, and it will contain cells, no, that will eventually release your ADH, sorry, that will eventually secrete, no, your ADH and oxytocin, no. However, these hormones, no, are not produced in your pituitary gland. They are produced in the hypothalamus, no, and the one that releases, no, your hormones is the posterior pituitary. Okay, and in terms of arterial supply, no, it's supplied by your superior hypophyseal artery, infundibular artery, and inferior hypophyseal artery. No, again, no, there's one more question, no, about the blood supply of your pituitary gland. No, your hypophyseal arteries, no, originate from which major artery? No, sige, chat box. Your superior inferior hypophyseal arteries originates from what major artery? Okay, no, very good. No, your hypophyseal arteries originate from your internal carotid artery. No, again, 1 point. No, natanong before. Internal carotid artery. Okay, next. No, proceed tayo sa heart. No, so far again, no, maraming natanong about the heart, specifically the coronary vessels and yung partner niya, no, when they come along outside the surface of the heart. Okay, so let's start with, no, what accompanies your great cardiac vein. No, it is accompanied by your anterior interventricular artery. No, your small cardiac vein is accompanied by right marginal artery. Your middle cardiac vein is accompanied by your posterior interventricular artery. Okay? So our mnemonic is gas ramp. Now, I don't know if you have a mnemonic already, no? But with me, no, I memorize it, no, using this way. No? Gas ramp meaning great, no? Great cardiac is for anterior interventricular artery. Your small cardiac vein is accompanied by your right marginal artery, while your middle cardiac vein is accompanied by your posterior interventricular artery. Okay, so saan sila, no? This is your right marginal artery, no? And they come along with your small cardiac vein. Okay, your great cardiac vein is here. Ayan, no? And sino yung kasama niya? It comes along with your anterior ventricular artery. Okay? And sa likod, your posterior interventricular artery is accompanied by your middle cardiac vein. Okay? Now, no, proceeding with the location of the valves, no. Wag kayong mako-confuse when we talk about the location versus the auscultation, no. Your location, kung nasan siya, no? Surface landmark, kung nasan siya. The auscultation of the valves, no? Yung location ng auscultation ng valves, kung saan siya best heard, no? So in terms of location muna, no? Nasaan siya? Your tricuspid valve is at the fourth ICS, no? Behind the right half of the sternum, fourth intercostal space. Okay? Your bicuspid valve is at your fourth costal cartilage left, no? Your pulmonary valve is at the third costal cartilage, again left. Okay? Your aortic valve is behind the left half of the sternum, third intercostal space, no? So what are the implications, no? Yung location, no, yung ibang valves are located at the costal cartilage, no? So what's the implication, no? When you auscultate there, wala kang maririnig, no? That's why you will auscultate on some other parts, no? That's why may ibang location, no, for auscultation. Okay, so again, the location, aortic, it's third ICS left, pulmonic, it's third costal cartilage left. Okay, your mitral valve is at the fourth costal cartilage left. Your tricuspid valve is is located, no, at the fourth ICS right. Okay, while you have different location of auscultation, you will only hear the sounds of the heart valves at intercostal spaces. So walang costal cartilage dyan. So for your aortic valve, it is best heard at the second intercostal space, right? Okay? Your pulmonic valve is best heard at the second ICS left. Your mitral valve is at the fifth ICS left, while your tricuspid valve is at the lower left sternal border left. Okay? There was actually a clarification about your tricuspid valve. No, it was raised, no? A clarification about the tricuspid valve, no? Because different books, no, say a different laterality. Okay? In Snell, it's written na right, no? Right. However, left, no, for some people, your tricuspid valve auscultation. However, no, in Moore and in Bates, your tricuspid valve is at the left parasternal border, no? So far, no, hindi naman siya lumalabas na right or left, no? Kasi either sa mga choices, no, when I look back, hindi siya lumalabas na right or left before, no? So lumalabas siya as a parasternal border. Okay? So wala tayong masyadong kakabahan, no? Kung right or left ba. Hindi masyadong kakabahan if right or left ba yung isasagot. Okay.
Dagdagan ko lang para universal na lang, buong top-notch system, left ang sagot nyo.
Okay.
Okay? Always pray. Pulmonic ba? Ano pinag-usapan?
Sorry.
Tricuspid ba? Always pray to... Tama, left. Sundan natin yung nandun sa Bates.
Sa Bates na.
First na lang yan, buong top-notch. Okay? Top-notch wide if ever matanong.
Alright, thank you, Doc. So this is actually from Bates, no? So your aortic valve is located second ICS right. Your pulmonic, no, or pulmonary valve is at the second ICS left. Your mitral valve is at the fifth ICS left. Okay, and in here, no, as universal answer will answer left parasternal border for the tricuspid valve. Okay. Okay, I hope everyone gets it. No, so now more about the valves. No, your valves, starting with your tricuspid valve. Okay, your tricuspid, no, tricuspid, no, definitely tatlo ang cuffs. No, so you have anterior, septal, or and inferior or posterior cusp. Okay, your bicuspid, based on the name, no, bicuspid, dalawa ang cusp niya. You have one anterior, you have one posterior. Okay, your pulmonary valve, okay, has one posterior and two anterior cusp, while your aortic valve has three cusp pa din, no? One anterior and two posterior, no? So what if the question, all of the valves, no, in the heart contain three cusp except, okay? So anong answer natin, no? Except your bicuspid valve, no? Siya lang yung merong dalawang cusp. Okay? So looking here, ayan, no? Yung parang letter Y or letter T, no? Yun yung mga division niya. So you have 1, 2, 3 cusp for the tricuspid. Again, 1, 2, 3 cusp for the aortic. 1, 2, 3, no? For the pulmonary valve. And then bicuspid, siya lang yung parang hiwa lang, no? So you only have 2 cusp. Okay? So all of them has 3 cusp except for the bicuspid valve. Yan, okay. Proceeding now with your lungs. Okay? So your lungs, ano mga point of question dito? Right versus left, no? Usually gano'n, no? And it's actually in your handout, no? So your right lung, okay, it's larger and heavier, it's shorter and wider, no? It's heavier because, no, it has more lobes, no, as compared to your left lung. Okay, so quantifying it, it's around 445 grams. Okay, while your left lung, it is lighter, it's around 395 grams. Your right lung contains 3 lobes. Okay, so it's upper, middle, and lower lobes, and divided by 2 fissures. You have oblique and you have a horizontal fissure. Okay, we'll look to the picture later. Okay, your left lung, on the other hand, it has 2 lobes and it is divided by only 1 fissure. You have the oblique fissure. Your right lung, no, walang issue about its segments. It contains 10 bronchopulmonary segments. Okay, while your left lung, in some books, it's 8. In some books, it's 10 segments. No, um, we'll discuss later. No, and for the grooves, your right lung contains the grooves for your SVC, superior vena cava. You have the arch of the azygos vein and a groove for your esophagus. While your left lung contain grooves for the aortic arch, descending aorta, and left subclavian artery. Okay? So as you see, no, usually parang mga arterial side, no, ang grooves na nakikita natin sa lung, no? More of part of the arterial system, no? Like your aortic arch, your aorta, descending aorta, and you have that left subclavian artery. So usually arterial side, merong grooves at the left lung. While at the right lung, you see grooves for the venous side, no, venous system, like your superior vena cava and your arch of the azygos vein. Okay, no, sa fissures baka malito kayo. Your horizontal fissure is only seen in your right lung, no? Kasi, no, sa right lung lang merong letter H, tama? So horizontal, letter H, no? Sa right lang siya, no? Sa left wala naman siyang letter H. Okay? So this is your picture, no, of the right, no, and the left lungs. So this is your right lung divided into 3 lobes. You have an upper lobe, a middle lobe, and a lower lobe or inferior lobe. Okay, this is your oblique fissure, no? So it will divide the middle and your inferior lobe. Okay, while this is your horizontal fissure, no? Only seen in your right lung. Okay, so it divides the superior and the middle lobe. Okay, while your left lung, okay, left lung, it only contains an oblique fissure. Okay, so it will divide the upper and the lower lobe. So question, which lung contains the lingula? No? Right or left lingula? It is seen in your left lung. Okay, this part. No? This is your lingula. Okay, and another question, cardiac notch, no, is seen in which lung? Right or left? Your cardiac notch. Okay, your cardiac notch is seen in your left lung. Okay, parehas na tanong na. Okay, so cardiac notch and lingula are both seen in your left lung. Okay, horizontal fissure is seen in your right lung. Okay, so moving on sa bronchopulmonary segments. This was asked in the most recent board exams. Now again, your right lung contains 10 bronchopulmonary segments. Your left lung contains 8, no? 8 to 10 bronchopulmonary segments. Discuss muna natin yung walang issue, no? Sa right lung, dito pala, no? Ito yung right. Your right lung contains 10, okay? So, and again, it has 3 lobes, no? And each lobe will contain bronchopulmonary segments. So sa superior or upper lobe, you have apical, posterior, and anterior. Okay? Your middle lobe will contain medial and lateral bronchopulmonary segments. Okay, that's 2. While your inferior lobe, okay, ang mnemonic natin dyan is PALMS, no? PALMS. Posterior, anterior basal, lateral basal, medial, basal, and superior. Okay, so that's a total of 1, 2, 3, 4, 5. So 3 sa superior plus 2 sa middle, 5 plus 5 sa inferior. So that's a total of 10 segments. Okay, walang issue. Okay, however, okay, sa left lang, medyo may issue. Dito yung issue no, na superior lobe. Sa inferior lobe, walang issue din. Sa left lang, sorry. Okay? So sa inferior lobe, actually, it's just the same as the inferior lobe of the right lung. No? You have you have posterior basal, anterior basal, lateral basal. You actually have medial basal and a superior, superior bronchopulmonary segments. Actually, palms din. No? Ang issue is nasa superior lobe, no? In some references, ito sila, no? You have apical, posterior, you have anterior, superior lingula, and inferior lingula. So that's 1, 2, 3, 4, and 5. Okay, so 5 plus 5, no? 5 sa superior, 5 sa inferior, that's a total of 10, no? So doon nakuha yung 10, no, for the left lung. However, no, in some other books, no, they combine the apical and posterior, so that will be apico-posterior, and they combine the lingula. Okay, they combine the lingula. So nagiging apico-posterior, you have an anterior, and then you have a lingula. So that would be 3, no, instead of 5. And then your inferior lobe still is 5, no? So 5 plus 3, it's 8, no? So in some books, it's 8, no? Kaya naging 8 to 10 bronchopulmonary segments. So far, hindi naman siya tinatanong, no? In some cases, lumalabas naman siya na 8 to 10, no? In the choices. Okay? So that's all about the lungs. Okay? So moving on sa GI, no? Sa GI system. Okay, starting with the duodenum. Okay, so try to answer this question. No? The only mobile portion of the duodenum. Okay, a first, second, third, or fourth. Ayan, no? Majority got the correct answer. So that's letter A, no? The only mobile portion of the duodenum is the first, no? Is the first part. Yeah. Okay? Actually, sa exams namin to lumabas, no? That's November 2020. Okay, so your duodenum, it's a C-shaped tube approximately 10 inches in length. Okay, around 25 cm. Lumabas na yan, no? Gaano kahaba ang duodenum? No, that's 10 inches. Okay, sige, activate the chat box, no? Anong other organs ang 10 inches? Excuse me. Ano pang ibang organs ang 10 inches? Okay. Correct, no? Esophagus. Esophagus, 10 inches din, no? Ano pa? Excuse me, sorry. Okay, so may mnemonic tayo, no? I have the mnemonic, dudes, no? Dudes with 10 inches, no? So, dudes with 10 inches. Number 1, sa duodenum. Okay? 10 inches, duodenum. Second is the ureter. Okay? That's around 10 inches as well, the ureter. Next one is the descending colon, 10 inches again. Followed by the esophagus, again, it's 10 inches. And the sigmoid colon. Okay, your sigmoid colon is actually 10 to 15 inches. Okay, so dudes with 10 inches. So far, sino mga tanong na? Si duodenum, natanong na 10 inches. Si ureter, natanong na din, no? Na 10 inches. And recently, si esophagus, no? Natanong na 10 inches. Okay, so baka next na si descending colon, no? Saka si sigmoid colon. Okay, again, all of them are 10 inches. So the duodenum is retroperitoneal except for the first inch, no? Which is part of the first part of the duodenum. Okay, then that happens to be the mobile part of your duodenum. Okay, so this is your duodenum. The first part is the superior part. Okay, the second part is the descending part of the colon. Okay, the third part is the horizontal part. Okay, and the fourth part is the ascending part. Okay, so your first part is at the level of L1. Okay, your second part, no, it will span the level of L1 up to L3. So in this here, no, while your third part, okay, the horizontal part is at the level of L3, while your ascending part will run from L3 going up to the level of L2. Okay, so it's the one in your table. Okay, measurements, I leave that to you, but this is coming from more. So the longest segment of the duodenum is your descending part, or your second part. Okay, so again, the first part, or the superior part, it contains a mesentery, and it is the mobile segment of the duodenum. And it is attached to the hepatoduodenal ligament and the greater omentum. Okay, your second part, okay, what's the peculiarity about it? It will be pierced by the bile in the main pancreatic ducts. Okay, so this is where the secretions from the pancreas and the gallbladder will eventually drain. And it is the portion that curves around the pancreas. Okay, the third part, it is in close relation with your superior mesenteric vessels. Okay, while your fourth part, or the ascending part, okay, it is a landmark, where the ligament of Treitz, okay, is attached, and this will demarcate the junction between your duodenum and your jejuno-ileal complex. Okay, so this is your superior part, again, the mobile part. The second part is here, the one curving around the pancreas. Okay, again, the one receiving the secretions from the gallbladder and the pancreatic ducts. Your third part is here, the horizontal part, in close relation. It is traversed by your superior mesenteric vessels. Okay, the ascending part is here. Okay, so that's all about your duodenum. Okay, so for next would be your jejunum and ileum. What about them? Lagi silang kino-compare, para silang maraklara, ng small intestine. Okay? Two exams na to tinatanong, the two past exams, jejunum lagi versus ileum. Okay? Yeah. So let's start. Your jejunum, it comprises the proximal 2/5 of this jejuno-ileal complex, and it occupies the upper part of the peritoneal cavity and below the left side of the transverse mesocolon. Okay, while your ileum, it's the longer segment. It contains the distal 3/5, and occupies the lower part of the peritoneal cavity, the pelvis, and the right lower quadrant. Okay, in terms of the walls, your jejunum has thicker walls and heavier walls. Okay, so anong implication? Kung thicker ang walls niya, heavier ang walls, mas nagko-contract siya. So, ang nangyayari, when food is there, pag nag-contract siya, maipapass niya na right away, to the ileum. That's why in gross exam, it will look emptier. Okay? So, your ileum, on the other hand, has thinner and lighter walls. So, in terms of vascularity, since mas muscular si jejunum, it will have greater vascularity, and in effect, ano magiging kulay? It will be deeper red, in color. Okay, as compared to your ileum, which is less muscular, less vascular, so it will appear paler pink. Okay. Next, in terms of the plicae circularis, your plicae circularis are the mucosal folds. Okay, so mas prominent, yung mucosal folds in your jejunum. So it's larger, taller, and more numerous. Okay, while in ileum, it's shorter and widely separated. Okay, your arterial arcades, it is less prominent, around 1 to 2 only in your jejunum ileum. Okay, since mas konti siya, mas maraming spaces, that's why you have translucent areas, which we call windows. And since less prominent, ang arterial arcades, your vasa recta has to be longer to um, to make it supply your small intestine. We'll look at the picture later. And then, so your ileum will contain more arterial arcades and a shorter vasa recta. Okay? In terms of fat, there is more fat in your ileum, and your Peyer's patches are only present in your ileum as well. Okay? So this is the comparison between your jejunum and ileum. No? So your jejunum is in the upper part, your ileum is in the lower part. Okay? So look at it, no? Sino ang mas maraming foldings, mas maraming mucosal folds? So that's your jejunum, no? Your jejunum. And as you look at the vessels here, no? So the vessels here, isang ano lang siya, no? Isang beses lang siya dumaan. So this is your arterial arcade. Okay? And then, no, para makaabot yung blood supply to the wall, no, the vasa recta has to be longer. No? As compared here, no, less ang plicae circularis, no? You have less mucosal folds. And then, ang dami niyang arterial arcades, no? Dahil sobrang dami niya, yung vasa recta only needs to be shorter, no, for it to supply your ileum. No? In terms of fat, no, kita naman, no, sino mas yellow, no? So fattier si ileum. Okay? And then yung mga tigyawat diyan, no? Yung mga parang tigyawat, no? Those are lymphoid nodules, and then when they aggregate, no, that will be your Peyer's patches, and you only see them in your ileum. Okay? Did you get it? Yes. Okay. So that's one point of questioning in jejunum, no, in your small intestine. So jejunum versus ileum. Okay. There's actually one other table from your SNEL, no, comparing about large intestine naman, no. And it was actually asked na rin, no, in the one exam. Okay. So small versus large intestine, no. So in terms of mobility, your small intestine is more mobile, no? Except for your duodenum. Again, no, only the first part of the duodenum is mobile. Okay. While your large intestines, no, the ascending and the descending parts of the colon are fixed. Okay. For the small intestine, all parts has a mesentery. Again, except for the duodenum, no, the second to fourth part, no, again because they are retroperitoneal. Okay, while your large intestines, majority are retroperitoneal except for the transverse and sigmoid colon. Okay, so in terms of diameter, huwag ka na muna masyado mag-isip, no? Small intestine, definitely it will have smaller diameter, while your large intestine, it will have larger diameter. Okay? Your one peculiarity, no, in your large intestines, your longitudinal muscles will form 3 bands, no, that we call as Tenier coli. Okay? Again, another peculiarity in your large intestines, it will contain appendices epiploaceae. No? So this appendices epiploaceae are fatty tags, no, that we can see externally. Okay? And in terms of the walls, your large intestines, okay, contain or appear sacculated. Okay? And this sacculation, parang longganisa. Okay? And this we call this as hostra or hostration. Ayan, no? This is your small intestines. Ano makuha na natin dito? Ito na lang, no? Your large intestine. Now, again, yung mga peculiarities about your large intestines, you will have Tenier coli. Okay? The longitudinal bands, no? The Tenier coli. And then you have the fatty tags. You will see the appendices epiploaceae. And yung parang longganisa, no? Yung sacculations, we call this hostra or hostrations, no? All of them are peculiar in your large intestines. Okay? Internally, your small intestines will contain again the mucosal folds or your plicae circularis, which are not seen in your large intestines. Okay? Your Peyer's patches, as mentioned kanina, are only seen in your small intestine, specifically in the ileum. Okay? Your small intestine again will contain villi. Okay? And lastly, for the large intestines, you have deeper crypts of Libercone. You have no Paneth cells and more goblet cells. Okay? And these are summarized into this mnemonic. No? Mnemonic natin is large. No? So what do we mean by large? So this mnemonic will all pertain to the large intestines. Okay? So large. The Libercone crypts are deeper or more prominent in the large intestines. Letter A for appendices epiploaceae. Your appendices epiploaceae are only seen in your large intestines. Next, for letter R, paano yung mnemonic? Medyo ipipilit natin hostra, hostra for letter R, the sacculations, the longanisa appearance, your hostra is a feature of your large intestines. You have letter G, you have goblet cells. Okay, so more prominent or more numerous in your large intestines, and you have the external longitudinal bands, okay, or your teniae coli. Okay, so large. Libercone crypts, the appendices epiploaceae, hostra, goblet cells, and external longitudinal bands. Okay. Then proceeding to this next question, next concept. This is about your epiploic foramen. In-include ko to because this is the most frequently recalled question and concept in the past exams. About the it's about the epiploic foramen. Okay, so try to answer this question. Placing your finger in the epiploic foramen of Winslow. Okay, the ventral and dorsal structures immediately palpated are duodenum and quadrate lobe of the liver. Is it the portal vein and the IVC? Is it the hepatoduodenal ligament and the caudate lobe of the liver? Letter D, the gastroduodenal artery and common bile duct. Sa chat natin, ang bilis na mag-Google. Okay, so majority answered letter B, walang issue, kasi that's actually the correct answer naman. Okay, so this is your epiploic foramen or your foramen of Winslow or the omental foramen. Okay, isa siyang lagusan, opening, from the greater sac, into the lesser sac, and it lies immediately inferior to the hepatoduodenal ligament. So ito yung ginagawa, ito yung nasa question, when we place a finger in your epiploic foramen, so what can we palpate? Okay, and we have a diagrammatic representation. Okay, so in anatomy, for me, it really helps when pictures are simplified, rather than looking at the actual pictures. So this is a diagrammatic representation of the relations of your epiploic foramen. Okay, so your epiploic foramen is in the middle. Okay, so what's anterior? So anterior, what's located? You have your hepatoduodenal ligament. Okay, and remember, your hepatoduodenal ligament contains several structures that to include your portal vein, your hepatic artery, and your bile duct. Okay, so this is your hepatoduodenal ligament. Okay, may artery, the hepatic artery. You have the portal vein here and the common bile duct. Okay, and then posteriorly, you have the inferior vena cava. Okay, so yun nasa question, the portal vein anteriorly and the inferior vena cava posteriorly. Superiorly, you have the caudate lobe or caudate process of the liver, and inferiorly, you have the first part of the duodenum. Okay? Yeah. Okay, so moving on, this is actually the last concept that I want you to to remember. The ureter. Para siyang pituitary gland. Again, na past exams, walang palya may question about the ureter. Okay? So starting with the definition. So it's a muscular tube. It begins at the renal pelvis, extending from the kidney to the urinary bladder. Again, it belongs to our mnemonics, na dudes with 10 inches. So ureter, in length, it is 10 inches or 25 cms long. Okay? And one concept na tinanong din about the ureter, okay, it will contain 3 constrictions, which are potential sites of stones, renal stones. First is at the uretero-pelvic junction, where the renal pelvis joins the ureter. The second one is where it crosses the pelvic brim and the external iliac artery. And the third constriction is where it pierces the bladder wall. Yan. Okay? So one at the renal pelvis, one at the pelvic brim, okay? And one as it pierces at the once it pierces the urinary bladder wall. Okay? So your ureter, matagal nang tinatanong ang course ni ureter, no? Ano bang course niya, no? Tourism, accountancy. Charot lang. So anong course niya, no? Kasi yung ureter nyo sa 10 inches na yan, marami siyang pinagdadaanan. Okay? So let's trace the ureter coming from its origin, okay? So from your ureter, it will descend from the renal pelvis. Okay? So this is your renal pelvis. Okay? So it will continue to become your ureter. Okay? At ang unang hadlang, no, sa ureter, okay, your gonadal vessels will pass anteriorly. Okay? So your ureter is posterior to the gonadal vessels here. Okay? Again, your ureter is posterior to the gonadal vessels, no? This is where we use the water under the bridge, no? The water is the ureter, the bridge is the gonadal artery. Okay? Again, your ureter lies posterior to the gonadal vessels. Okay? So ayan, tutuloy siya. Ang susunod na hadlang, no, ay nandito, no? So it will enter the pelvis, okay? And it will cross the bifurcation of the common iliac artery. Okay? Trace muna natin. This is your aorta. This is your common iliac artery. This is your internal iliac artery. This is your external iliac artery. Okay? So sabi dyan, it will cross the bifurcation of the common iliac, no, in front of the SI joint. So therefore, it is anterior to the common iliac, no, and it is actually anterior also to the internal iliac artery. No, this is your internal iliac, anterior to the common and internal iliac arteries. However, no, in relation to the external iliac artery, it lies more medial. No, your ureter. This is your ureter. This is your external iliac. So your ureter lies more medial. It is medial to the external iliac artery. Okay? So nakalagpas na siya dyan, no? And at the level of the ischial spine, bigla siyang liliko, no? So una, it runs down the lateral wall of the pelvis. And at the region of the ischial spine, liliko na siya, no? In order for it to reach your urinary bladder. Okay? So in males and in females, the course that I have discussed, okay, are the same, no? So parehas lang that it will pass under the gonadal vessels. It will pass anterior to the common and internal iliac and medial to the external iliac. However, no, nung patapos na, doon mag-iiba sa males and in females. Okay? So, pagpapasok na siya in males, no? This is in males. So, pagpapasok na siya sa bladder wall, no? See, this is your ureter. Okay? Ang huling hadlang ay ang vas deferens or your ductus deferens. Okay? So tinanong to parang 2 exams ago, no? So what structure crosses your ureter before it pierces the urinary bladder wall? It's your vas deferens. Okay? And in females, no, bago siya pumasok again sa urinary bladder wall, no? So in females, it turns forward medially beneath the broad ligament, and ang magko-cross naman sa kanya is your uterine artery. So again, in males, it is your vas deferens. In females, it's your uterine artery. Okay, and eventually to the bladder wall, to the urethra, and then to the CR. Okay, and finally, about the blood supply, venous drainage, and lymph drainage. Okay, so your ureter is divided into thirds: the upper, middle, and lower end. Okay, so your upper end, it will be supplied by the renal artery and vein. Your middle part, it's supplied by the gonal artery and vein. Okay? Your lower end, it's supplied by the superior vesical artery and vein. Okay? One question, saan lymph nodes magde-drain ang ureter? All of them will drain into your lateral aortic nodes and iliac nodes. Again, tanong na to. Okay? Nerve supply, it's coming from the renal, testicular, and hypogastric plexuses. Okay? And one last question about the ureter, no? Saan magre-refer ang ureteric pain, no? Sa urologies. Charing. Okay, so ureteric pain, it will be it's usually referred sa ipsilateral lower quadrant of the abdomen, okay? Pero yung lumabas sa exams, no? It will refer into your inguinal region, into the groin, okay? So you actually, when you are suspecting ureteral stones, okay, you ask, no, in the history whether they feel pain in the inguinal region, okay? So that's actually the end of my slides, no? So that's all for the summary lecture of your anatomy and histology. Okay, thank you for listening.
All right, Doc, thank you very much. Ang ganda ng lecture natin, very short but then again concise ang anatomy lectures natin, ang summary lecture. All right. So before we start our quiz matter session, I think Dr. Banzuela has an announcement.
Okay. Thank you first to Dr. Ernest Calasans, one of our best teachers in Top Notch. Si Ernest will be the one to give your pearls. So that's our version of the final coaching. And then we're going to do something new starting with your batch. The pearls will be systems-based. So gagawin natin circulatory system, respiratory system. We've realized that students are actually doing this already. Instead of studying by regions, they're studying by systems, especially in anatomy. We don't really recommend that for na gagawin ninyo during the time that you're reading the main handouts or the main lectures. Kasi ang board exams mismo, hindi siya tulad ng USMLE na tightly integrated across systems. But we do realize na kapag nag-discuss tayo ng systems, mas matututo at mariretain talaga ng estudyante. Kasi sabay-sabay lahat ng blood vessels, sabay-sabay lahat ng nerves. So, ang gagawin natin for your batch, after talking with your teachers, Mother Bruce, and feedback ng mga past students, okay, regions-based pa rin tayo pagdating na main lectures, main handouts. But by the time we do pearls, it's going to be systems-based. So circulatory system, respiratory system, okay, ganon. Nagpapagawa na rin ako ng 2 posters sa media team ng Top Notch. One poster is yung concept map ng lahat ng nerve sa katawan. Tapos yung isang poster din naman is yung lahat ng blood vessels naman sa katawan. So it's a concept map. Okay, basically para mga branches yon na makikita mo na ito, this will give rise to this. So inaayos pa nila. We plan to give it, okay, definitely before your mastery period. We want you to print that along with the other posters that we've given you for physio and biochem. Okay? Now, I apologize for some of you may have sumakit ang ulo sa corrections na nakita niyo na posibleng nakita talaga doon sa practice test 1 and 2. We do have some quality control mechanisms sa Top Notch. It basically will involve several layers, mga 3 to 4 layers of people reviewing that. Dahil mo pa siya doon sa trigger namin na I stipulated that to the team that I want corrections sa practice test limited to 2 questions per 100 items. Anytime lumampas yun, may automatic review ko na kung bakit nangyayari. So guys, for the practice test, for the subsequent subjects, starting with pharma tomorrow, I asked the media team to pull it out and then to do a double check. That double check will involve 4 pairs of 2 teachers each reviewing the questions. So this will happen starting with practice test 1 ng pharmacology tomorrow, and it will be conducted for all the practice tests that we're going to give to you starting tomorrow. Practice test 2, practice test 3, practice test 4. So 4 na pairs, 2 teachers each to double check. So may 4 na layers na mag-check, 8 people all in all na mag-check lahat ng practice test natin. I apologize for that, guys. Some of them are encoding errors. Some of them are really factual errors. Some of them minsan double answers. We're going to release by tomorrow, okay, all the corrections, okay, for the practice test ng physio and anatomy. We're compiling them. Okay, isa halip na ibibigay ko personally sa mga student via FB. I decided compile na lang and then release to everyone. Kindly correct your physio practice test 1 and 2, okay, based on those clarifications. And hopefully, fingers crossed, okay, starting with the practice test ng pharmacology by tomorrow, that will be minimized, if not entirely removed. Okay? The goal is to keep it at the very least 2 corrections per 100 items. Okay? Yung sa main handout, it's really much more difficult to, kahit meron kang teams na nag-check dyan, ultimately, content expert are the teachers. So minsan talaga, other than encoding errors, hindi may iwasan na magkaroon yan pag factual errors. But so far, we've been able to limit them for physio. For anatomy, for the main handouts, we have about 5 or 6 errors here that kailangan ma-change. Some of them are typo na medyo kailangan talagang palitan. Okay, some of them talaga nakita na okay. Okay, based dun sa post-market surveillance natin, kailangan ayusin. So we're going to announce them. I apologize for this, guys, also. Okay. We're going to definitely make improvements as we go. Kinausap ko na yung entire team natin, including the teachers, on what I want to happen, okay, para ma-improve further yan. And I will also talk to the teachers for the other subjects para kahit paano ma-minimize. Okay, tulad ng sinabi ko sa inyo at the start, okay, we have very smart teachers at top-notch. You can see sina Ernest, okay, you can see sina Jed, matatalino tao yan, top ng boards yan, But even the smartest people will make mistakes. Even the best, the kindest people will make mistakes simply because they're human. If you're dealing with hundreds of pages, hundreds of questions, inevitable na may 1 or 2 mistakes. You multiply that by 6, 7 teachers that you have for anatomy, and that will basically, okay, be significant. So ang gagawin natin is for the main handout corrections, okay, as part of quality assurance, I'll be discussing them with every summary lecture. Okay? So kindly, I'll give you 2 minutes. Let's have a rest muna. Troy, 2 minutes, kindly get your main handouts. I'll tell you the corrections para mamarkahan nyo na diretso doon sa pages nyo. So mag-CR muna kayo. Okay, get a drink, get your main handouts. 2 minutes, Troy, count. Okay, let's resume. Okay, so some corrections for your anatomy and histology main handout. Okay, so anuhin ninyo guys. I'll indicate the page numbers also. So I'll discuss first the corrections. Okay, and then later on, there's another part for clarification. So clarifications, tama yung nakasulat sa handout, pero may mga students na nagmi-misinterpret. So kailangan natin i-discuss. Okay? So page 2, right upper quadrant, change yung term na occipital, the one highlighted here, to maxillary. So infraorbital foramen, maxillary dapat yung nakasulat. Okay? Change that. So that's one. Okay, next. This one, page 26, right upper quadrant. Instead of level 5, the correct answer should be level 6. Cervical lymph node level 6. So reading the explanation of the teachers directly, okay, according to tumor, lymph from the thyroid gland that drains initially to the pre-laryngeal, pre-tracheal, and pre-paratracheal lymph nodes, which are located at level 6 nodes. Okay, sa Schwartz, however, nakalagay lang thyroid cancers may metastasize to any of the cervical lymph node regions. So best answer for this question is not LN5, but lymph node level 6. Okay, so this is for page 26, right upper quadrant. Next. Location of the right vagus nerve on page 33. Okay, so take a look at the highlighted portion. Right vagus nerve gives rise to the right recurrent laryngeal nerve, which hooks around the right subclavian artery and ascends through the superior mediastinum in the groove between the trachea and the esophagus. Superior mediastinum in the groove between the trachea and the esophagus. Okay, next. The thoracic ducts empties into, okay? So kindly disregard the image. Tama naman yung nakasulat sa text. Okay, but when we had this redrawn by one of our artists, mali yung drawing niya. So please disregard the image on page 38. Okay? According to the teacher, okay, doing the review, if based po on the Snell and Moore, yung image po yung mali, yung iba, mas tama po yung nasa guide question on page 38. For both sources, the thoracic duct drains into the left brachiocephalic vein, okay, at the left venous angle where the left subclavian joins the left IJV. Okay. So kindly disregard the image, this one on page 38. We're going to have this later on. Okay, next. Uterine anteversion on page 93. So kindly change the word uterus into cervix. So version is the relation between the cervix and the vagina, angle of 90 degrees. Okay? Cervix dapat. Page 93. Next. Boundaries of the triangular interval on page 104. So hindi dapat teres minor, dapat teres major. See the highlighted portion here. Okay, teres major dapat, hindi teres minor. So mental hiccup of the teacher concerned for this part. Triangular interval boundaries above should be teres major, not teres minor. Page 104. Next. Okay, on page 110, the distal row header and trapezium description, kindly correct. Trapezium, I think ito yung may kulang sa handout ninyo kung di ako nagkakamali. Okay, some rows were missing, okay, inadvertently. It's an encoding error, this part. So trapezium, okay, four-sided, articulates with the first and second metacarpal, scaphoid, and trapezoid bones. So you can add this to your handout. Okay, ready? Next. Okay, parasympathetic innervation to the heart. Okay? So, nag-usap na kami ni Dr. Lianis dito kasi kung mapapansin ninyo, iba yung nakasulat sa anatomy textbook, iba yung nakasulat sa physio textbook. So, ang agreement namin ni Dr. Lianis dito, sabi ko sa kanya, the parasympathetic innervation will only include the atrium, the cardiac atrium. It will not include the cardiac ventricles. So when you say you decrease the rate and contractility here, okay, you're referring to atrial contractility and not ventricular contractility. Okay? So kindly modify the ones in your handout. Okay? Kasi nung tingnan din namin, okay, atrial contractility, tsaka yung general, they didn't use the term ventricular contractility doon sa more instead. So, ganito na lang for the entire top-notch system, please follow the one given to you for physio. So, this has something to do with the differences between the anatomy textbooks and the physio textbooks. So, in terms of the parasympathetic innervation to the heart, again, the parasympathetic innervation will only extend to the atrium. So, it will affect atrial contraction. It will affect heart rate via the SA node found in the right atrium. It will also affect conduction velocity via the AV node found between the atrium and ventricles. But ventricular contractility, okay, will not be affected by parasympathetic nerves simply because parasympathetic innervation will not extend, okay, to the ventricles. Okay, so walang parasympathetic innervation ang ventricles okay, natin. Okay, so page 38. Next. Histology. Okay, this is really a typo. We apologize for this. This is classically known naman to the students. Pag CD4, yung T helper, that's supposed to be associated with MHC class 2. And then pag CD8, yung cytotoxic T cells nyo, okay, yung Scout Rangers ninyo, that's supposed to be associated with MHC class 1. So inadvertently, the teacher place another 1 here. Okay, hindi sinasadya. That's considered a typo na. Okay, yung classic mnemonic dyan, of course, 4 times 2, 8. 8 times 1 is also 8. Parehong 8 dapat yan. Yung CD4, tsaka yung CD8 na yan. Okay, so simple typo, kindly correct. Page 19 of your histology handout. Okay, the cytotoxic T cells should be MHC class 1. Next. And then finally, okay, the sublingual gland, page 22 of your histology handout. The sublingual gland is primarily mucoid ang secretion, mucus, primarily mucus or mucoid with few serous cells. Okay, so paratid exclusively serous, watery type. Submandibular primarily serous or watery type. And sublingual is the one primarily mucoid with few serous cells. Okay, in facial, someone also asked me, Doc, talagang Simpa and Para will both increase salivation? Yes. The difference is in the type of saliva. Simpa will cause a mucoid type of saliva, while Para will cause a watery type of saliva. You need salivation happening in your tongue, in your mouth all the time. Otherwise, it will damage your excoriate tissues. So both Simpa and Para will actually increase the salivation. Ang difference is in the quality, the type of salivation that they will produce. Watery or serous type once again for Para, mucoid or sticky type for Simpa. So sublingual, okay, gland, one of your 3 major salivary glands. So page 22, it should be primarily mucoid or mucus, yung saliva na na-produce. Okay? So those are the corrections. Okay, the next portion are clarification. So ito, tama yung nakasulat sa handout, tama yung nasa video, but nalilito yung mga estudyante, so kailangan i-discuss. Okay? So first, so no need to no need to write this down, this portion. Okay, you just need to understand kung bakit nagkaganon. Okay, ano yung mga pinapaklarify ng mga estudyante. So on page 7, one student actually asked the relevance for asking this question at that particular part, the Dejery-Rossi syndrome. So Dr. Lians and Dr. Ong stated that this guide question was inserted as a feedback from a previous exam. It introduces the syndrome and the concept that the thalamus is in charge of relaying sensation to the cortex. Thus, syndromes affecting the thalamus can cause altered sensations. Lesions of the postcentral gyrus would mostly present with loss of sensation. Okay? So, tama yung nakasulat. Tama din na naka-insert yan. Okay, dyan sa part na yan. Yung relevance, okay, is to introduce the syndrome and the concept, okay, of the thalamus being in charge of sensations going to the cortex. Okay? Next, trigeminal nerve, specifically mandibular nerve. Yun lang yung gustong i-point out dyan. Kailangan nyo i-add tong part na to para hindi nalilito. Okay? Kung sa V3, V1, V2. So this is on page 14, left upper quadrant. Okay? So by the next batch, ilalagay na namin yan kasi nalilito yung mga estudyante dito. Tama yung text, pero dagdagan nyo na lang nitong part na to, specifically the mandibular nerve, para hindi masyadong like nalilito yung mga tao. Okay? Next. Page 29, right lower quadrant. Okay. B is a correct answer here. Okay, sa part na to. But dog is also a correct answer. It's also acceptable upon review of all the anatomy teachers that we have in Top Notch. D rin daw is considered tama. Choice D is also acceptable since the case is pertaining to an injury of the spinal accessory nerve, which innervates the sternocleidomastoid, causing weakness in turning the head to the contralateral side of the injury. So boy or dog can be considered correct answers for this question. Okay? Next. So this is on page 29, right lower quadrant. Next. Page 34. Okay, pinapasabi ng teacher ninyo at may nalito dito sa part na to. Okay, yung mga true, false, ribs, etc. If it's just true and false, true versus false ribs, then yung true will be yung 1 to 7 na ribs, yung false yung 8 to 12. If it's between true versus false rib proper versus floating, okay, true is 1 to 7, false ribs proper is 8 to 10, and then floating is 11 to 12. And then, okay, vertebrochondral ribs is 8 to 10, vertebral ribs is 11 to 12. So clarification lang, pinapa-add ng teachers ninyo, okay, at nalilito kung ano yung true, ano yung false, ano yung floating, ano yung proper, ano yung vertebrochondral, at ano yung vertebral ribs. So you can write this down and I'll give you some time to write them. $30 left before you proceed. Okay, let's proceed. Okay, xiphoid process, surface landmarks versus dermatomes. Tama yung nasa handout, pero nalilito yung mga estudyante. Okay, Doc, bakit yung iba? Yung dito sa xiphoid, etc. So, ibang surface landmarks versus dermatomes. So, from Dr. Calasans, okay, emphasize this. Surface landmark, meaning this structure corresponds to this vertebral level. Tip of the xiphoid process is T10. Okay? Dermatome, for this area of the skin innervated by a single sensory nerve root, yun yung T7. So never confuse yung dermatome with the surface landmark. Okay? So this is on page 35 naman. I hope at this time we're already doing yung technique na sinasabi namin sa inyo. Yung sa halip na nagbabind kayo sa left, you're binding it onto the right. Para pag binuksan mo to, especially if you're right-handed, the printed portion is on your left and then may blank pages doon sa right. Yung right ngayon, pwede mong lagyan ng mga notes mo. So that's the one that we recommend. Try to look at your top-notch online primer for further information regarding yung proper ring, yung recommended ring binding natin for right-handed students. Okay, medyo iba kasi siya eh. Hindi siya yung nakasanayan natin during med school. Follow that. Very useful. Yung ganon. Sa halip na mag-ring bind ka sa left, sa right na siya i-ring bind. Let's proceed. Okay. Page 43. Okay, another clarification regarding this. Tama yung figure, tama din yung sa text. Nalilito yung mga estudyante. So, kailangan i-clarify ni Dr. Llanes. Yung figure na to on page 43, the figure does not state which coronary artery supplies what area of the heart. It's just a visual representation of the course of the arteries. Okay, so according to Moore, the right marginal artery supplies the apex of the heart. So basically, follow the text written dun sa handout niyo for this particular part. Okay, at baka ma-confuse kayo with the picture. Next. Okay. Esophagus, is it intra or retroperitoneal? Okay. So this is on page 59. Okay. So if we're talking about this is from Dr. Bradley Ong. Okay. If we're talking about the abdominal esophagus, it's intraperitoneal. If it's thoracic, it's going to be retroperitoneal. So part of it is intraperitoneal, and then part of it is retroperitoneal. Patanong nga, Louie, sa mga anatomy teachers natin, alam ko ang classic na description nito is it's mainly one of those. It's mainly retroperitoneal or mainly intraperitoneal. Patanong, Louie, kung ano yung mas higit dyan. Kung ano yung primary classification actually ng esophagus. Kung primary or mainly retro or mainly intra.
Yes, Doc.
Sige. Okay. Sabihin mo na lang sa akin once I finish with this. Okay. So again, for esophagus, it's partly intraperitoneal, partly retroperitoneal. Abdominal esophagus is intraperitoneal. Thoracic, okay, esophagus is retroperitoneal. Page 59. No corrections, just clarification. Tama na kasulit sa text. Nalilito yung mga students. So it's important to point out kung ano yung talaga, deal. Okay? So next is the clarification of the transversalis fascia and arcuate line on page 56. So it is true, blah, 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 something written here. Okay? So tama, yung nakasulat dyan. True that the posterior wall is absent below the arcuate line and the rectus muscle lies in contact with the transversalis fascia, making the transversalis fascia the most posterior portion of the abdominal wall. The transversalis fascia is the only structure in the posterior area below the arcuate line. Okay. Next. Next, someone asked, Doc, ano yung LART on page 64? Okay. Hindi nakuha yung context ng previous line. May nakasulat kasi doon parang binabanggit niya yung may left, may anterior, and then for the, I think this is for the left and right vagus, hindi ako nagkakamali. And then may nakasulat lang dun sa baba, remember LARP. So hindi na-gets ng student kung ano yung LARP. If it's an acronym that stands for something else. It's a mnemonic. The one in page 64, yung word na LARP there. It's left anterior, okay? That's the left vagus nerve is anterior, while the right vagus nerve is posterior. So yun yung ibig sabihin. It's a mnemonic. It's not an acronym for something. It's a mnemonic. Tignan sa page 64. Okay? So next. Page 73. Okay, so for this guide question, okay, someone asked regarding the answer. So let me read verbatim from the comments of Dr. Vibar for this portion. The left colic is a branch of the inferior mesenteric artery. So if the inferior mesenteric artery is blocked, the left colic cannot provide the blood supply to the transverse colon. The other blood vessel that could supply blood to the transverse colon is the middle colic from the superior mesenteric artery. The question is which could provide collateral circulation. Okay? So, tama pa rin yung sagot. Transverse colon is both mid-gut supplied by SMA and hindgut supplied by IMA. Branchial and pharyngeal arches. So may nagtanong nito, nalito yung mga estudyante regarding branchial and pharyngeal arches. Kung Doc, bakit iba yung nakasulat sa video versus yung nakasulat sa handout? Please take note that those are synonymous terms. Branchial and pharyngeal arches are synonymous terms in embryology. Okay? So, clarification. Tama yung sagot. Okay, so this is the explanation provided by Doc Vivar. Okay. Next. Page 109. So, this is something to do with Doc. Bakit iba yung nandito sa picture nyo versus yung nilagay nyo for Galeazzi's fracture? Dito sa Galeazzi's fracture na text nyo, proximal third of the radius is fractured and the distal end of the ulna is dislocated at the distal radio-ulnar joint. Okay? So from Dr. Calasan's verbatim, okay, Galeazzi fracture, the proximal third is fractured, radius is fractured, and the distal end of ulna is dislocated at the distal radio-ulnar joint. However, the class Galeazzi is actually a distal middle third radius fracture. So you need to be familiar lang with the two concepts. So tama, parehong picture. Okay, tapos description ng Galeazzi fracture na text. But please take note, okay, even though this is the actual description in Snell, the classic Galeazzi fractures, or ito yan si Ernest, I'm sure tama to, is actually a distal middle third radius fracture. Okay? So parang naka-base to doon sa classic na Galeazzi, yung text naka-base doon sa nakasulat sa Snell. Okay? So this is on page 109. Next. Okay. Kindly disregard the percentages. So this is from Dr. Kurt Asperas. On page 99, what is the most likely location of the crypt orchid test is correct. The answer is correct. It's an inguinal canal. Okay. So kindly disregard. Okay. Yung mga percentages according to him. Okay. So siya yung nag-ano niyan. Disregard, answer to the guide question is correct. So this is page 98. Next. That's it, okay, for anatomy. So I apologize for the corrections. The clarifications we're going to do as an exercise with every summary lecture. Again, we're going to improve doon yung system natin of checking, of double checking the handouts, of double checking the practice test, flashcards, everything. Okay? Take note, yung sa main handouts, the encoding errors can really be virtually zero, but yung factual errors, nasa teacher na kasi eh. So we're going to try and limit that to mga 3 per teacher at most. Kung pwede talaga, wala. Okay, sa physio ko naman guys, 2 lang halos and very minor. Dito sa anatomy, medyo, I think it's around 6 dahil 6 yung teachers nyo eh. 1 o 2 mali, bawat teacher, you can do the math. Kung bakit nagkakaganyan. Yung sa practice test, yung medyo hindi ko gusto yung nangyari. Okay, so we're going to release the corrections, compiled format for the practice test by tomorrow. Okay, Sunday. Okay, we're going to give it later around 7 p.m. And then yun nga, for the subsequent practice test, I've instructed the entire team of teachers natin, media team, 4 layers, 2 people each, made up of teachers, okay, residents, consultants, okay, to double check all the questions sa practice test niya from here on. Okay, if we can minimize to a maximum of 2 questions, kung pwede nga wala eh, preferred ko talaga wala. Okay? Pero kung meron man guys, pasensya na, personally coming from me, tao lang. Okay, tao lang yung mga nag-check niyan, hindi machine. So even if you run it ng meron at merong makakalusot. Yun nga lang classic na MHC1, MHC2, hindi mo mapapansin yun eh. Even if you run grammar correction sa MS Word, even if you have several eyes looking at it, okay, people will make mistakes. So it's just important na ma-mention natin to, ma-discuss natin with every summary lecture, okay? At yung clarifications, more important than the corrections, yung clarifications ninyo, okay? ino-compile natin at i-report ngayon with every summary lecture. Para at least nakikita ng lahat, a lot of people are having problems with this concept sa handout, so it's good na madi-discuss. Baka for the subsequent subjects, yung clarifications, I will have it discussed by the one giving your summary lecture na din. Okay? So thank you so much. Let's proceed with the Quizmaster for the next 30 minutes. Tomorrow we're going to give at 8 a.m. the introduction for pharmacology. Kindly attend that. If you're not yet done with anatomy, or if you feel, Doc, hindi ko pa na-master, that's okay. You're normal. That's physiology. Okay? By the time na mag 8 a.m. bukas, pharma na kayo, guys. Don't look back. Okay? Ano na muna, itabi na muna yung anatomy by 8 a.m. tomorrow. Pharma na tayo by tomorrow. Magagaling yung teachers nyo na parating. Si Gabby at si Iya. Parang ano yan? Balik uli physio. Ang ano yan, ang climate. Okay? So thank you so much. Back to you, Dr. Troy.
All right, thank you very much, Dr. Broly. I hope our students have taken down the notes for the clarifications and corrections from Dr. Broly. So today we're going to have your Quizmaster session for anatomy. But first, before we start our Quizmaster discussion with Dr. Jessica Comedian, we'll flash muna yung PowerPoint natin, no? And then you will have to get your own pen and paper, siguro sa iPads na lang ninyo. And then you write down your answers for each of the questions muna before we start our discussion. All right?
So
guys,
I think, Troy, 30 seconds for
30
each
seconds
question.
lang.
Except
Yes.
pag mahaba yung text, you give them
Yes,
40.
45.
Sige, 45. Very good. Continue.
Sige po, sir. So anyway, get your pen and papers ready na lang, doctors. So I'll be flashing our Quizmaster already. Ayan. I hope that everyone can see our PowerPoint slide. Okay? So you guys have 30 seconds to answer each question. Pag mahaba yung question, 45. I'll adjust. Okay? So beginning with question number 1. Ayan. The right ovarian vein drains into the following choices. All right, 30 seconds is up. Second question. Ayan, I'll give you 45 for this one. Okay, next question. Question number 3, 30 seconds. Okay, move on to number 4. So for you guys watching at home through the Top Notch portal via live stream, you can also answer on your own all of the Quizmaster session questions, okay? So next, number 5. Okay, number 6. And number 7. Number 8. Number 9. Oops. And last, number 10. And that ends this part. So I will so before I turn over to Dr. Jessica Comedjan, rules lang natin for the discussion, guys. You will be able to see the questions and the choices again. Okay, for those who are in our Zoom session, you will be asked to answer a poll for those questions. You'll be given again 30 seconds to answer the question. Okay, our quiz master will read the question once and options once. Okay? So
10 seconds lang to input.
sorry,
Tuloy.
Doc.
Kaya
Yes,
ng 10 seconds lang to input, not 30 seconds.
yes, po. Ayan. So, yun guys, I'll turn over na the floor to Dr. Jessica. Doc Jessica, good evening po.
Yes, hello, good evening po. Doc, I can't share pa po. Pwede po pa-allow yung sharing. Thank you po. I'm using another device, Doc. ICAS iPad po.
Okay.
Doc Jessica, good evening. Si Doc
Good
Jessica
evening
may
po.
pinakamagandang provide na feedback sa amin for the entire subjects, guys. Sobrang ang dami naming nabago sa handouts dahil kay Doc Jessica. Thank you for that, Doktora.
Thank you, Doc.
Ayan, Doc. I already made the co-host na yung ICAS iPad.
All right. Once again, good evening, everyone. Again, I'm Dr. Jessica Comedian Castillo. I would like to say sorry for my voice as I'm still recovering from a URTI. But let's go ahead, discuss our quiz master session this evening. So number 1, the right ovarian vein drains into the letter A, left renal vein, Letter B, inferior vena cava. Letter C, suprarenal vein. And letter D, pudendal vein. So the answer is inferior vena cava. So this structure in the anatomy of our body is remarkable because this is one of the exemptions sa mga asymmetric parts ng ating katawan. Because yung ating right ovarian vein, it drains directly to the inferior vena cava, while yung left ovarian vein, dumadaan muna siya sa left renal vein before siya didiretso sa ating inferior vena cava. So remember that yung right, it goes straight to the inferior vena cava. Ayan. It's also remarkable to note that yung left renal vein naman natin, magkaiba din sila ng, medyo nakakalito itong concept na to. Kasi yung left renal vein, it is longer than the right renal vein. Pero pag ang pinag-usapan naman natin ay ang artery, yung right naman ang mas mahaba compared sa left. Okay? So pag vein, left is longer, pero kapag artery, right is longer. Okay, so this is the reason why most of the time the left kidney is used for transplant kasi nga mas mahaba yung left renal vein compared to the right. I hope that's clear. Let's proceed to number 2. Mang Adong got involved in a mauling incident. On PE, you notice that his right eye is deviated medially. When asked to gaze to the right, it remains the same, so hindi gumagalaw. What nerve is most likely injured? Ayan, I'm receiving answers and most of it are correct. The answer is letter D, abducens nerve. Pero sometimes in the exam, they will not give you the name of the nerve. What they will give you is the cranial nerve number. So it's very important that when we study, we know yung mga eponyms ng mga structures because examiners can sometimes use different names para lang malito tayo. So remember that our abducens nerve is our cranial nerve number 6. So for our extraocular muscles, remember na yung lateral rectus and medial rectus, opposite sila palagi ng action. Okay? Yung lateral rectus, ang action niya is abduction. That's why kapag na-injure siya, ang injury naman to the lateral rectus will result to adduction, which is opposite sa medial rectus natin. Kasi ang action niya ay adduction, pero injury to it will result to abduction. So remember that all extraocular muscles are innervated by cranial nerve number 3 except yung ating famous na mnemonic, LR6 and SO4. Ang ating lateral rectus ay innervated by cranial nerve number 6 while yung ating SO4 or superior oblique is innervated by cranial nerve number 4. So let's proceed to number 3. This was discussed extensively earlier by Doc Calasans. Which of the following is false regarding the course of the ureter in males? So medyo nakakalito siya kasi statement yung choice. So you really have to imagine kung ano yung dinidescribe. So for this one, the answer is letter C. Bakit? Mali yung letter C kasi ang sabi niya, from the ischial spine, yung ureter daw ay it turns backward, patalikod, to enter the bladder. So this was asked in the March 2023 exam kung paano daw nag-enter ang ureter sa bladder in males. So mali yung letter C because, ayan, we know that the ureter runs down the lateral wall of the pelvis in front of the internal iliac artery to the ischial spine and it turns forward. Hindi siya nagto-turn backward. That's why false yung letter C kasi ang sabi it turns backward. The truth is the ureter turns forward, paharap muna siya before it enters the lateral angle of the bladder. Okay? Let's proceed to number 4. This is actually a tricky question.
Okay,
And multiple
Doc Jess.
Yes
Sorry,
po.
sorry to disturb. Magpapa-poll po muna ako for each question po before the discussion po nung sa ano sa before
Okay.
the rationale po muna.
Okay po. Sorry
Alright.
po. Ay,
It's okay, Doc. It's
Dok,
okay.
kaso po yung slides po, may answer na po ko agad.
Okay. I'll fix that part na lang. I'll be sharing the slides na lang po. For the rest
Okay, sige.
the quizmaster na walang sagot muna. And then ayun.
All right, Doc. No problem.
Just give me ano po. Okay. So the PowerPoint is ready po. So and can you see my screen po?
Yes, Doc. Okay na po.
All right. Sige. I'll be starting the poll na at this point.
Okay. So Doc, I'll read the question pa po, no?
Yes. Just once lang
Okay.
po.
So, yes, okay po. So let's proceed to number 4. The muscle that rotates the scapula is innervated by a nerve that originates from letter A, C5 and C6 only, letter B, C5, C6, C7, letter C, C7 and C8, and letter D, C7, C8, and T1. All right, majority of you got the correct answer, which is letter B. 87% answered letter B. So this is actually a tricky question. Okay, dun sa mga nag-aas sa number 3, we'll go back later. Let's first finish yung entire quiz master. So for number 4, this is a tricky question. In fact, majority of the questions in March 2023 ay ganito yung approach. So for this one, this is a 3-step question. Ang tinatanong niya is the muscle that rotates the scapula ay innervated daw by a certain nerve at saan nanggagaling yung nerve na yon. So you need to know 3 information to be able to answer this. Next slide, please. Ayan. So first, what muscle rotates the scapula? We know that it is the serratus anterior muscle. Second, what innervates the serratus anterior? We know this by the famous mnemonic SALT, di ba? Serratus anterior is innervated by the long thoracic nerve. Pero yung final question is, ano daw yung origin ng long thoracic nerve? So the answer is C5, C6, and C7. So this leads us back sa ating brachial plexus. Next slide po. Ayan. So remember yung ating famous mnemonic na SALT, serratus anterior is innervated by our long thoracic nerve or yung long thoracic nerve of Bell. So if we look at the figure sa ating brachial plexus, makikita natin na yung thoracic nerve, siya yung bumababa mula sa C5, C6, and C7. Next slide po. Ayan, so this is the figure na ating brachial plexus. Makikita nyo from C5, C6, C7, doon nanggagaling yung long thoracic nerve. So it's very important to review the entire brachial plexus because in the recent boards, parang tatlo yung questions about the trunks, divisions, cords, etc. of the brachial plexus. Nakaramihan ay 2-step to 3-step questions lahat. Okay, let's proceed. Okay, number 5. The gallbladder fundus approximately lies at Letter A, 7 costal margin. Letter B, 8 costal margin. Letter C, 9 costal margin. And letter D, 10th costal margin. All right. Majority of you got the correct answer, which is letter C. 45% answered letter C, which is 9th costal margin. This is actually the exact question asked in the recent boards. When I reviewed yung mga references natin for anatomy, medyo nahirapan akong hanapin kung saan exactly sinabi na it lies approximately at the 9th costal margin. So next slide po. I found the reference doon sa Gray's Anatomy by Standring, yung anatomy book na sobrang kapal, at doon niya sinabi that frequently the gallbladder fundus lies in contact with the anterior abdominal wall behind the 9th costal cartilage. So remember that the gallbladder fundus, you can see in the picture, lies in contact with the anterior abdominal wall behind the 9th costal cartilage. Okay, let's proceed. Ayan. So remember that the gallbladder is flask-shaped and it is a blind ending diverticulum. That's why kapag na-inflame siya, it's very problematic kasi nga blind-ended siya. In real life, I'm sure most of you have already seen a real gallbladder. It's gray-blue in color, and it lies in between segments 4 and 5 of the liver. It's approximately 7 to 10 cm long, and its entire capacity is 25 to 50 ml. Okay, let's proceed. Number 6. The great cerebral vein of Galen drains directly to letter A, transverse sinus, letter B, straight sinus, letter C, sigmoid sinus, and letter D, internal jugular vein. All right, majority of you answered letter B, 65% answered letter B. The correct answer is letter B, which is straight sinus. Okay? So you can see yung ating cerebral venous drainage. Okay, ayan. In that figure, I zoomed in yung part kung saan nagjo-join yung inferior sagittal sinus and yung great cerebral vein kasi pareho silang nagdi-drain directly to the straight sinus. And from there, from the straight sinus, dumadaan sila sa confluence of sinuses kasi halos lahat sila dumadaan doon, kaya confluence, down to the transverse sinus, pababa ng sigmoid sinus. So don't get confused kasi meron tayong sigmoid colon, di ba? It's in the gastrointestinal tract. Meron din tayong sigmoid sinus which is part ng venous drainage ng ating brain. So I just want to share na bakit siya tinawag na sigmoid. Diba? If a word ends with oid, it means it's like or it's similar. So sigmoid is sigma, letter S. Kaya siya tinawag na sigmoid sinus kasi para siyang yung pababa ng letter S. So it's sigmoid sinus. Matatandaan niyo siya kasi siya yung pababa bago mag-drain papunta sa internal jugular vein. So same principle goes with the sigmoid colon, para siyang pababa ng letter S kasi yung shape niya is pababa. Pero remember that the great cerebral vein of Galen drains directly to the straight sinus. Okay, let's proceed. A little clinical correlate lang, meron tayong tinatawag na venous sinus thrombosis kung saan nagfo-form ng thrombus or nagkakaroon ng mga clot doon sa ating anywhere within the venous drainage ng ating brain. So usually this happens sa mga buntis kasi sila ay hypercoagulable or sa mga gumagamit ng OCP or yung mga nagpipills. Okay? Next item po. Number 7. The right lung can be differentiated from the left lung by the following except A, it is heavier, larger and wider. Letter B, it has 3 lobes and 2 fissures. Letter C, it contains grooves for the SVC, esophagus vein and esophagus. And letter D, it is smaller, lighter, and narrow. Okay, very good. 96% got the correct answer, which is letter D. The right lung is smaller, lighter, and narrower. So for questions like this na merong differentiation, how do you approach? Usually, kung ano yung structure na unang binanggit, yun yung dinidescribe. So for this, the right lung can be differentiated from the left lung by the following, except, kaso may except, so mababaliktad siya. If the question lang is the right lung can be differentiated from the left lung, so ang hahanapin mo sa choices is yung description ng right lung. Pero merong except, so ang hahanapin mo na sa choices ay yung description ng left lung. Okay, let's look at the table on the next slide, which is the differentiation ng ating left and right lung. So majority of you got it correct na yung left lung ay smaller, lighter, longer, and narrower. I believe this has been discussed earlier by Doc Calasans, especially yung next slide natin, which was asked multiple times in the recent boards. Yung nasa next slides, ayan yung lung segments. So kung nakinig kayo kanina, alam nyo na kung paano i-approach ang questions regarding the lung segments. In the recent boards, yung question about the lung segments, hindi siya objective. So kailangan mo talaga siyang i-imagine kung saan siya nakaposisyon, kung gaano siya karami sa left, gaano siya karami sa right. So kayo nang bahala mag-review. I believe nasa handouts nyo naman ito. So make sure that you go through the lungs and the lung segments. Okay, next item po. Number 8, Eden was brought to the ER because of chest pain that occurred suddenly while she was walking to work. After ruling out GI causes, you ordered for a 12-lead ECG which revealed ST elevations on leads 2, 3, and AVF. What is the location of the infarct? All right, very good. Majority of you answered letter C, 83%, which is the correct answer. Siguro mas sisipag kayong magbasa ng ECG during your internship. So, ang tinatanong ay, ST elevation sa leads 2, 3, and AVF, ano daw ang location? It's the inferior wall. Okay, let's look at the next slide para mas ma-visualize natin. Ayan, so this figure is very important kasi pwede din siyang ma-ask sa IM, sa patho. Ayan, so remember na pag tumingin tayo sa ECG, yung mga leads ay meron silang nire-represent na parts ng heart. So usually ang favorite itanong, itong inferior wall, which is the leads 2, 3, and AVF. Okay? Meron pa tayong another figure in the next slide. Ayan. Using this figure, mas mai-imagine natin kung bakit kailangan doon ilagay yung leads at kung bakit yun yung nire-represent nila na part ng ating heart. So you can take a screenshot of this or a picture para meron kayong copy and you can review it on your free time. Okay? Let's proceed to the next item. Okay, number 9. The liver sinus is histologically divided into 3 zones. Which zone is most prone to hypoxia? Letter A, peripheral zone. Letter C, intermediate zone. Letter B, intermediate zone. Letter C, central zone. And letter D, portal zone. All right, majority answered letter A, 62%, but only 34% answered the correct answer, which is letter C, central zone. Ayan, central zone. Let's look at the next slide para hindi tayo malito. As I've mentioned earlier, when we study, remember to take note of the eponyms. Kasi sometimes, alam nga natin yung sagot, pero yung lalabas sa choice is yung other name, nalito na tayo. Okay, let's first review na yung histology ng ating liver ay merong 3 klase. Meron tayong tinatawag na hepatic lobule. Hepatic lobule is yung diagonal, ayan. Portal lobule nyo naman is yung yellow, tama ba? At yung hepatic sinus, which is yung tinatanong sa question, is yung diamond shape, which is yun yung laging tinatanong. Sige, let's proceed to the next slide. Let's look more closely sa ating hepatic sinus. Yan. Zone 1 is yung tinatawag na peripheral zone. Zone 2 naman yung tinatawag na intermediate zone. And zone 3 naman yung tinatawag na central zone. Okay? Kung titingnan natin sa next slide, makikita natin na yung zone 1 natin, siya yung pinakamalapit sa artery. Yes, zone 1 yung pinakamalapit sa artery and zone 3 naman yung pinakamalapit sa ating central vein. That's why zone 3 or yung central zone, siya yung pinakang prone na magkaroon ng hypoxia. Ayan, especially in cases of shock. Pero yung zone 1 naman, since siya yung pinakamalapit sa artery, siya yung nakakatanggap ng nutrients at unang nakakatanggap ng blood flow, siya naman yung most prone to infection. Okay? So remember that yung zone 1 ay yung peripheral and zone 3 is yung central. So don't get confused. Next slide po. Okay, last number. Number 10. A patient who suffered an infarct in the anterior cerebral artery will present with paralysis on the Okay, majority got the correct answer. 56% answered letter C, contralateral lower extremities. So yung ganitong concept, this was asked also multiple times in anatomy, in surgery, in IM, and even in patho. Ayan, concept ng stroke. So kapag ang infarct ay nasa anterior cerebral artery, the paralysis will present on the contralateral lower extremity. So let's look at our circle of Willis. Let's review yung ating circle of Willis. Ayan. So remember na yung ating circle of Willis, it's composed of several arteries, mainly originating from the internal carotid and the vertebral artery. Okay? So kapag yung anterior cerebral artery, yung nagkaroon ng infarct, the presentation will be contralateral paralysis and sensory loss sa lower limb. Let's look at the next slide, where naka-enumerate yung mga arteries that originated from the internal carotid and the arteries that originated from the vertebral artery. Because sometimes, hindi nila itatanong directly kung ano yung artery. Minsan, itatanong nila kung saan siya nanggaling and kung anong effect noon pag nagkaroon ng infarct on that certain artery. Let's look at the table on the next slide, which is the comparison ng different stroke presentations. So yung nasa question natin, ang infarct ay nasa ACA. So the presentation would be contralateral paralysis ng lower limb. Remember na kapag ACA, yung na-stroke or yung nagka-infarct, mas prominent yung paralysis sa lower limb. Kapag naman MCA or middle cerebral artery ang nagka-infarct, mas prominent yung paralysis sa upper limb and sa face. Okay? So pag dumating yung patient sa ER, by its presentation pa lang, pag pinii mo siya, makita mo kung anong itsura niya, pagdating niya sa ER, may idea ka na kung anong artery yung possibly involved. Ayan. Pero may catch pa sa middle cerebral artery. Kasi kapag dominant hemisphere yung naapektuhan, the patient will present with aphasia. Pero kapag non-dominant naman, they will present with hemi-neglect. That's why I included yung picture nitong clock. This was drawn by a patient na merong non-dominant infarct sa kanyang MCA, meron siyang hemi-neglect. Hindi niya pinapansin yung kabilang side ng pagkatao niya. So isang side lang, nabubuhay lang siya on one side. Ayan. So for the posterior cerebral artery infarct naman, it will present with a contralateral hemianopia with macular sparing kasi siya yung malapit na sa ating optic nerve. Okay? So last slide is a clinical correlation. Meron tayong tinatawag na man-in-a-barrel syndrome. This happens kapag kayong infarct ay nag-occur sa mga watershed areas ng ACA and MCA. Tinawag siyang man-in-a-barrel kasi both upper and lower extremities niya ay paralyzed. So ang nagagalaw niya lang is yung kanyang head and neck. So buong katawan niya hindi niya magalaw, para siyang nakakulong sa barrel. That's why it's called man-in-a-barrel syndrome. Okay? So next slide. I believe last slide na to. Thank you so much for listening. And sana you do your best. Take it one day at a time. Huwag niyong madaliin. Kayang-kaya niyo yan, guys. Good luck. Thank you.
All right, thank you, Doc Jessica. I just have a few questions from our audience right here. So clarifying lang po, I'll just move to the slide na pinapa-clarify po nila, no? Clarifying po on question number 3. For question number 3, tawag mo dito, hindi po ba mali din yung option A, hence making it an answer as well daw po?
Okay. So, siguro nalito kayo kasi option A refers to the course of the ureter in females. So, ang tinatanong is course ng ureter in males. So, technically, mali siya kasi ang dinidescribe dapat lahat is about sa males. Kasi ang nire-refer ng option letter A is the ureter in females. Pero remember na kapag may na-encounter kayong gantong mga question, always choose the best answer. So for this question, although mali yung letter A, kasi hindi siya nagre-refer sa males, it refers to females. I hope hindi kayo nalito ha. Letter A is tama for females, pero mali siya for males. Pero since meron tayong mas best answer, our answer is letter C. Okay? So I hope that clarifies your question.
All right,
Thank you po.
Dr. Mara. Do we have some other questions on the floor? If nahihiya pa kayo, you can like just chat in on our chat box or even message me sa Viber. Okay, so I don't think we have any more questions for Dr. Dr. Jessica. So ayun lang po. Thank you very much to both our speakers, Dr. Calasans and Dr. Jessica. Thank you Okay, so thank you very much again for joining us here at the Top Notch Portal po. We have learned a lot. I think Doc Rolly has some final words to impart to us.
Thank you very much, Dr. Jessica. Thank you very much, Troy. I'll see you everyone tomorrow at 8 a.m. So we'll have someone from the past batch again from March 2023 discuss to us kung ano yung nangyari for pharma. Okay, ano lang yan guys, 20 minutes lang yon at most, kaming dalawa. Magbibigay ako ng intro sa mga teachers, tapos kung ano yung recommendations namin on how to study for that subject. And then sa other, after that, yung previous na student from March 2023 will talk. So total of 20 minutes kaming dalawa. And then you have your Mother Goose coffee breakfast with the MG tomorrow also. So I've told them, keep it 15 to 20 minutes. Okay, magpaano sila ng konti, magbigay ng GCash or raffle, ng pizza, ng food. Okay, para masaya. Medyo light yung breakfast natin, kasama niyo yung mga MG ninyo. To discuss anything under the sun. Ibang MGs will do different things. So the MGs will have freedom kung ano yung paano nila i-conduct yung MG sessions nila for tomorrow. And every intro natin to that. Thank you so much, Troy. Okay, play mo na yung ano natin, outro natin.
All right. Thank you very much po, Doc Roy. So, before we end, we would like to share with you ang aming send-off video from last March 2023. Oops, wait lang. Technical difficulties. Wait. Ayan.
Ito na naman tayo bagong simula. Huminga ng malalim, alisin ang kaba. Tapos na ang kahapon, pwede na yan itapon. Huwag lang ang mga aral, dapat yan ay ibaw. Katulong mo sa panibagong hamon. May paparating na bagong araw, pwede kang lamunin o pwede mong sabayan. Aral ang kahapon, pwede kanyang gabayan.
Kung ako sa'yo, tumayo ka na dyan. Huwag ka na magpahuli. Kami ay sundan patungo sa liwanag. Abutin ang tala. Pagkatapos pagkita sa mundo, pusong nagbabaga.
Upang lahat ay mamulat sa aking susulat. Parinig sa lahat ang aking ulat. Huwag kang mabahala, ang Diyos na ang bahala.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo. Sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang sige, sige lang sige. Walang imposible. Walang imposible.
Nagniningning ang pangarap ng iyong pusong humihiling. Nakalimutan ang kahapon, sana'y dinggin. Sigaw ng aking puso, hindi susuko, hindi susuko.
Ilabas ang iyong pangarap, huwag mo yang itatago.
sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang, sige, sige lang, sige. Walang imposible. Napapagod, naiinip, natatawa, nagtataka, naiinggit, nagagalit, nangangawit, nabibigla, nalulungkot, nabubugnot, nahihiya, natutugso, nakukonsensya, nauubusan din ang pasensya, nasasaktan, nagmumura, pero lumalaban pa rin dahil natuto na.
Hanggat ako'y humihinga, sugod ng laban pa. Pangarap pabutin, kumislap tulad ng mga bituin. Sige lang, di ka nag-iisa. Sige lang, sige pa.
Walang imposible, sige lang, sige. Abot mo ang mundo, malapit malayo, sama-sama tayo. Hanggang sa dulo, ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang, sige, sige lang, sige. Walang imposible, sige lang, sige. Abot mo ang mundo, malapit malayo, sama-sama tayo. Hanggang sa dulo, ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang, sige, sige lang, sige. Walang imposible. Walang imposible.
Kung kaya ko, kaya mo. Sige lang, sige. Eto na naman tayo bagong simula.
All right, guys. So that is it for our anatomy and histology. Oh my God, wait lang. Anatomy and histology summary lecture and quiz master session 1. So thank you guys. Walang imposible. Sige lang, sige guys. Samahan nyo ng tatag ng loob at tatag ng puso. See you all soon on your next summary lecture and quiz master sessions. This is Doc Troy signing out and have a great night, everyone. See ya!
Thanks, everyone.